Managing clinical teaching around other responsibilities. Clinical teaching is challenging. There's just no question about that. This is from a human medical journal, and it here is outlining what they consider to be their barriers, and they're the same as ours. Time constraints, conflicting demands from clinical work, research work, administrative work, going off to teach. It can be unpredictable and it can be difficult to prepare for. You don't always know what's coming in the door on a given day. You've got multiple levels of learners. Sometimes you've got second and third years there on many rotations, and you've got fourth years, and you're working with an intern, all of those things. Here, what they describe as patient related challenges for us, the patient and the client, we've got these sort of challenges. And then finally, how are we rewarded or recognized for what we do in our clinical teaching? So this is a set of challenges that is true for clinical teaching in health sciences broadly and is definitely true for us in veterinary medicine. There are two different ways described in the literature to think about clinical training, an academic model and an apprenticeship model. And the academic model is thinking more about what is the student learning? How is the student thinking this through? How are they putting together information that they've gathered in their prior learning? The apprenticeship model is more, here's what we're doing today. Show me you know how to do this procedure. Watch me do this. Watch me talk to this client. Here's your opportunity to see the three most common things that we see in this sort of discipline, things of that nature. These two are not opposites and they're not mutually exclusive. I think all of us who have taught on clinics use both of these models, but sometimes it's good to think about them differently, because if you're very focused on providing an apprenticeship model, sometimes you're going to have to be very thoughtful about, oh, I'm going to go with the academic model today. We're going to work on this other thing. It's different, but it's still a valid way of providing clinical teaching. So, as I said, probably true that we're going to use a combination. And here's a snapshot of what was happening in the clinics in 2015. So at that time, the then chair of VCS, Dr. Robert Washaba, and I did a survey of all of the rotations in the hospital to sort of figure out what we all did. And that apprenticeship model, or show and tell, was by far the most common thing that was done across all of the rotations. And then after that came more of the academic sort of things: topic rounds, case rounds, critical scientific reading, assessing articles that had been found, taking assessments, things like that. You notice that in that study there was a big bar that was other, and these are examples of the other things. And again, kind of a nice mix of academic and apprenticeship. There were field trips, there were teaching, more didactic sorts of laboratories or lectures, online coursework, attendance at other things, language classes, a broad variety of things that our colleagues did to help students master the content that was appropriate for their clinical discipline. A survey done at the University of Tennessee College of Veterinary Medicine, specifically looking at how the administration could help faculty improve their rotations, found that what they wanted to focus on was improving their orientation and the structure of their rotation, being very specific about maximizing teaching moments. When do I need to stop and really work with the students right now? Participating in rounds and providing clear feedback. And in their system, they made sure that the faculty and the house officers both were engaged in all aspects of the rotation. You can't hand this off to the residents. This has to be something that is managed by the two of you together with appropriate levels of teaching from faculty to resident, resident to student over time. So the question is, for the faculty, do we need to be there all the time? Does somebody need to be with the students all the time? And if they're not, is that fair to the students? What can we give them? Is it busy work? What are we doing with them? And that really gets at that academic piece. There are many things that the students can be working on when there are no cases or when you're not directly with them that are still beneficial for them. And so examples include reading up on things. We saw this case. It didn't seem to me like you really understood this pathology. Go and read up about it, and then we're going to talk about it. And maybe keep some sort of running list on the board in the conference room or somewhere so that you know we're going to go back and we're going to bring that up again. We're going to talk about it again. Maybe you send them off to do something. Maybe they go to a specific clinic for the day, or maybe they go to the pet store and look for something. It's going to be something where you have your opportunity as an instructor to say, oh, this is a piece I really need them to understand, and here's a way they can go find that information without me just lecturing it to them or giving them a handout to read or something of that nature. A lot of our rotations have different cases and activities for the students to work through. So maybe they're reading radiographs, they're working through unknowns, they're writing a report so they get to practice that communication piece. They're creating client education materials, they're reading specific things that you want them to work through. And all of these can be things that you grade, or they can be things that the students submit so you knew they did it, and then you give them a model response so they can compare it themselves and see how they did. You can decide how much feedback you provide if you're going to give these more academic types of assignments. For the apprenticeship piece, there's a lot of different ways that you can do it. Most of us have a way that we like to do it. And there are a couple of models very specifically described in the literature that give you a reminder of some specific steps you might want to take. Most of them revolving around making the student make a commitment, making the student make decisions, driving them to explain to you why they're making the decisions that they are making, so you know that you're helping them learn how to think as a diagnostician and a clinician, and not just throwing back things that they remember about what they think is wrong with this animal. This is all presented on the clinical teaching page on the educational support website. Let me know if you need to know exactly how to get to that. And that's all presented there as a way of helping you think about what are specific things I can do in those moments of time that I have the students with me on clinics to make that as effective a time as it can be. If you have any other questions or concerns about clinical teaching, please contact the CVM Education Support Group at cvmces@umn.edu.